Fentanyl is a synthetic opioid analgesic that is commonly used in medical settings to treat severe pain, particularly in cancer patients or during surgical procedures. It is extremely potent, estimated to be approximately 50 to 100 times stronger than morphine. While pharmaceutical fentanyl is safe when used under medical supervision, using it illicitly fentanyl has become a major contributor to the opioid epidemic. Illegal fentanyl is frequently mixed with other substances such as heroin, cocaine, or counterfeit prescription pills, often without the user's knowledge. Because of its potency, even a very small amount can cause fatal respiration depression. Fentanyl was first synthesized in 1959 by Dr. Paul Janssen and was initially used in medical anesthesia due to its powerful pain-relieving properties. For many years, it was used primarily in controlled medical settings. However, during the opioid prescription epidemic in the 1990s and early 2000s, opioid misuse increased significantly. Around 2014, illicitly manufactured fentanyl began appearing widely in illegal drug markets. Since then, fentanyl has rapidly become the leading contributor to overdose deaths in the United States. Fentanyl has played a significant role in the opioid crisis in the United States. According to the Centers for Disease Control and Prevention, over 100,000 drug overdose deaths occur annually in the United States. Synthetic opioids, primarily fentanyl, are involved in the majority of these deaths. Fentanyl has become the leading cause of drug overdose fatalities, surpassing heroin and prescription opioids. The widespread availability of illicit fentanyl has created a major public health emergency affecting communities across the country. Certain populations are at higher risk for fentanyl abuse. Individuals with a history of opioid misuse or opioid use disorder are particularly vulnerable. Mental health conditions such as depression, anxiety, and trauma-related disorders can also increase the likelihood of substance misuse. Social determinants of health, including poverty, unstable housing, and limited access to health care, further increase this risk. Additionally, individuals who use multiple substances may unknowingly consume fentanyl because it is frequently mixed into other illicit drugs. Short-term effects of fentanyl use are similar to those of other opioids, but are often more intense due to its potency. Users may experience feelings of euphoria, relaxation, and pain relief. However, these effects are accompanied by significant risks such as sedation, confusion, nausea, and constricted pupils. One of the most dangerous short-term effects is respiratory depression, where breathing becomes slow and could stop entirely. This effect is the primary cause of opioid overdose deaths. Long-term fentanyl use can lead to significant physical and psychological consequences. Individuals often develop tolerance, meaning they require higher doses to achieve the same effect. Over time, this increases the risk of addiction and overdose. Chronic opioid use may also impair cognitive functioning, affect hormone levels, and cause persistent gastrointestinal issues such as constipation. Long-term use dramatically increases the risk of fatal overdose, particularly when fentanyl is combined with other substances. Healthcare providers must be able to recognize signs of opioid misuse during clinical assessment. Behavioral indicators such as drug-seeking behaviors, social withdrawal, and declining functioning in schools or work is what we need to look for. Physical signs can include constricted pupils, excessive drowsiness, slowed breathing, and unexplained sedation. Psychological symptoms may include mood instability, anxiety, depression, or impaired judgment. Fentanyl carries an extremely high risk for overdose due to its potency. Very small amounts can cause respiratory failure. Illicit fentanyl is often mixed with other substances such as heroin, cocaine, and counterfeit prescription pills, which increases overdose risk because users may be unaware they are consuming fentanyl. Naloxone is a life-saving medication that can reverse opioid overdoses if administered quickly. Evidence-based treatment for opioid use disorder includes medication-assisted treatment. Medications such as buprenorphine and methadone help reduce cravings and withdrawal symptoms by stabilizing opioid receptors. Naltrexone is another medication that blocks the effects of opioids and helps to prevent relapse. Naloxone is used in emergency situations to reverse opioid overdose and restore breathing. Non-pharmacological interventions play a critical role in recovery. Cognitive behavioral therapy helps patients identify triggers and develop healthier coping strategies. Motivational interviewing can improve treatment engagement and readiness for change. Group therapy and peer support programs provide social support and reduce isolation. Family therapy can help address relationship dynamics that may influence substance use. Patient education is an essential component of treatment. Patients should be educated about the dangers of fentanyl, particularly its high overdose risk. Training on the use of naloxone should be provided so patients and family members can respond to an overdose emergency. Patients should also be informed about the risk of combining opioids with other substances such as alcohol or benzodiazepines. Many patients require additional resources beyond primary care. Referral to addiction specialists or substance use treatment programs may be necessary for comprehensive care. Behavioral health counseling can address underlying mental health conditions contributing to substance use. Social services can help patients address housing, employment, and other social determinants of health. Ongoing follow-up is essential for successful recovery. Patients should have regular appointments to monitor medication effectiveness and adherence. Providers should assess for relapse risk and continue to address underlying mental health concerns. Coordinated care among healthcare providers, therapists, and community programs improves treatment outcomes. In conclusion, fentanyl is one of the most dangerous substances contributing to the opioid epidemic in the United States. Its high potency significantly increases the risk of overdose and death. Early identification of substance misuse combining with evidence-based treatments such as medication-assisted therapy and behavioral interventions can significantly improve patient outcomes. Addressing fentanyl abuse requires coordinated efforts from healthcare providers, public health systems, and communities.